I'm George Parag. I'm a dermatologist. I'm currently the chair of the Department of Dermatology here at Roswell Park Comprehensive Cancer Center. Let me actually take a step back. The most important is not treatment, it's prevention. Skin cancer prevention and primary prevention by using sunscreen, by using sun protective clothing, and by avoiding peak UV index hours is extremely important, especially when we diagnose skin cancer early in life. A lot can be done by reducing the burden of additional damage, by reducing additional UV exposure. When we diagnose skin cancer, the second thing to remember is that early diagnosis is key. When a skin cancer is diagnosed earlier, treatment usually is easier and is going to be less cosmetically problematic. Luckily for many of the early skin cancers, there are multiple treatment options available, but they may not be sort of all well suited for certain individuals. The gold standard treatment for skin cancers is going to be surgical removal. For melanoma, surgical removal is really the only good option because you want to limit the likelihood that that disease could locally come back or could spread. For non-melanoma skin cancers, surgical removal may be done by Mohs micrographic surgery or also surgical excision. In many cases, Mohs micrographic surgery offers potentially smaller scars and higher cure rates, and therefore that's the best and the gold standard option. In some cases, the benefit of Mohs surgery may not be there, and in those cases we'll be offering surgical excision. There are also some very early skin cancers where we may be able to offer less invasive procedures, where we may also be able to use local destructive treatments or even potentially field treatment methods that enable us to, by using certain topical compounds, eradicate early skin cancers. Unfortunately, we sometimes see skin cancer so late that surgical removal may not be the best option. In those cases, radiation oncology will help us design radiation treatment for some of the skin cancers. Occasionally, in advanced cases of skin cancer, we also need the help of our medical oncology colleagues to make sure that we can administer state-of-the-art chemotherapy or immunotherapy regimens to people who have been diagnosed with more advanced disease.